Thank you so much for joining us for our Back to School live series. My name is Nadia, and I'm a health promoter on the school health team here at Niagara Region Public Health. With the new school year fast approaching, we all know that there's lots of questions coming up. So today we have two very special guests to go through what to expect when returning to school. We have Pam, who is the team lead in our pandemic response division for the outbreak teams for schools. And we have Nurse Ashley, who is a school health nurse on our school health team.
Perfect. So thank you so much, Nadia, for having us here today. And thank you, parents and families, for keeping our children and communities safe. I know it's been a very challenging year and a half. So the ministry has created a very comprehensive back to school plan to ensure a safe return to school for both staff and students. So today, Pam and I are here to provide answers to common questions for parents, guardians, and families about what back to school will look like here in Niagara. We'll also share some ways that you can help prepare your child for back to school.
And as we head into the start of a new school year, schools will likely be the largest congregation of unvaccinated persons in our society. It is therefore public health's top priority to protect the health, safety, and well-being of all children in schools. Public health has been working with our local schools to provide further guidance to help keep our community safe. So much of what we'll answer today will mirror the guidance from the province. However, in some cases, Niagara Region Public Health is recommending additional or more extensive measures given the local learnings from the last school year, and these recommendations may, of course, change. So we encourage you to reach out to your children's school as well to find out how they are implementing these measures.
All right, so are the screening requirements, what are the screening requirements this school year?
Yeah, great question. So there are screening requirements again this school year. So same as last year, all staff, students, and visitors must self-screen every day before attending school. So your school will provide you direction on how they will check if the screen is completed. The ministry does actually provide a school screening tool that is available online. And the screening tool has actually been updated from last year. So you will notice a couple changes. They've included some information around vaccinations, and even some of the symptoms have changed as well. So runny noses, sore throats, and headaches are no longer listed as symptoms associated with COVID-19 on the screening tool. So the tool now has 5 symptoms listed. Now, however, parents are still expected to keep their child or children home from school if they do display any symptoms, even ones that are not included on that screening tool list. So whether you are vaccinated or not, any individual who is experiencing symptoms consistent with COVID-19 must not attend school and should either contact their healthcare provider or book a test appointment with the Niagara Health COVID-19 Assessment Center. Now, the screening tool will walk you through your options based on the answers that you provide. It will provide some guidance for you on what to do. We do encourage that you bookmark this screening tool either to your phone or your web browser so that you can easily complete it every morning before you send your children to school every day.
For masking, who is required to wear one and when?
So just like last year, staff and visitors, of course, are required to wear a mask, and students in grades 1 to 12, unless medically exempt, are required to wear properly fitted non-medical or cloth masks indoors in schools, including in hallways and during classes, as well as on school transportation like the bus. This year, we are also really recommending that with parental permission and when tolerated, that all children in JK and SK or junior kindergarten, senior kindergarten wear a mask as well. So masks may be removed indoors, of course, while eating and drinking, and maintaining at least a 2-meter distance from each other when possible. And we also recommend at Public Health that students wear masks outdoors if physical distancing of 2 meters cannot be maintained. And of course, for mask use, we also recommend that they be cleaned between uses. So when your kids bring them home, to throw them in the wash. We recommend sending extra masks for your child to change when they become damp, wet, or dirty. And before school starts, to teach your child how to put on and take off their mask. We also recommend sending a clean container or a paper bag daily with your child to store their mask in when not in use. And as well, you can always visit our website for more resources and videos that you can review with your child.
How will physical distancing be incorporated in the return to school?
Yeah, so physical distancing will be promoted in schools, same as last year. So this will be both inside and outdoors. Schools are encouraged to remove any unnecessary furniture, place their desk with as much distancing as possible between students. Desk should really be facing forwards rather than in circles or in groupings. There will be lots of posters and visual cues, floor markers to kind of help remind staff and students to practice physical distancing and also just to assist with the flow. Periods of student movements should also kind of be staggered to help decrease congregating and the amount of people in those areas. So as parents, what you can do is just to help remind your children about physical distancing, especially during outdoor play. You can come up with some really fun, creative ideas. So you could use fun items such as pool noodles or hockey sticks to help visualize that 2 meters distance. Or you could even kind of encourage some games like shadow tag that promote keeping distance while still being active outdoors and playing with their friends.
What about the use of shared spaces such as libraries, study halls, and assemblies?
Yeah, so shared spaces between classes should be ideally kept to a minimum, is what we are recommending here at Public Health, unless there is adequate space to keep all students at least 2 meters apart. We also recommend capacity limits to continue for these rooms, and they should be posted and followed. And for that reason, Niagara Region Public Health is recommending that even things like assemblies should likely at this time occur outdoors with physical distancing of 2 meters between individuals, or to continue with the virtual assemblies at this time.
How will schools encourage appropriate hand hygiene practices?
Yeah, so schools will provide alcohol-based hand sanitizer, same as last year again. So they will ensure that it's available throughout the entire school at many entrance points in all the classrooms. It is very easily accessible for students and staff to use. So hand hygiene should be conducted by anybody that's entering the school, and it should be incorporated into the daily schedule at regular intervals throughout the day. So even above and beyond what is usually recommended. So for example, making sure that they sanitize or wash their hands before eating and after using the washroom, certainly. So at home, what you can do, again, you can remind your children about when and how to clean their hands. The school will also continue to provide education about hand hygiene and how to cover their cough and sneezes. And also Public Health does provide additional guidance, and we offer the schools some education materials to utilize with their students. So you can find a lot of our resources for hand hygiene on our website.
Will sharing of items such as toys in kindergarten or books, computers, and any other devices in other grades be allowed?
Yeah, so the use of shared materials and supplies are permitted in schools. As the risk associated with transmission for COVID-19 from shared objects is low, the focus will be on regular hand washing before and after use of shared items, and covering coughs and sneezes to reduce the risk of infection related to the shared equipment. And it'll be mainly like within their own classes or cohorts. And of course, all shared items are also recommended to be cleaned and disinfected at least twice a day or whenever they are dirty.
And what are the recommendations for recess and breaks this year?
Yeah, so there actually are some changes this school year compared to the last year. So although we still do encourage that students stay within their cohorts or their class room groups, not just indoors, but outdoors. There may be times that students of one cohort are allowed to mix with another. So it is really important that they still keep that 2 meters distance, and they're encouraged to wear their mask. So shared equipment such as balls, ride-on equipment should be kept within the cohort, and also practice hand hygiene before and after use.
So then will students be required to wear masks while doing physical activities?
So students are recommended to wear masks outdoors when unable to physically distance, including when able to tolerate during high and low contact sports or activities outdoors and indoors. If there is mixing of classes or cohorts, then masking and physical distancing is required. And again, that's a recommendation from Niagara Region Public Health. It is recommended as well that schools open windows or doors when possible to increase the ventilation as well in the room. Schools are allowed to use gyms, swimming pools, change rooms, and weight rooms as well, with, again, health and safety measures in place.
Are extracurricular activities going to be allowed?
Yeah, so this is a big change from last year. So clubs, activities, sports teams, bands, and other extracurriculars are permitted this school year. So since this may involve students from different cohorts, physical distancing and mask use is recommended for all of those participating when possible for both indoor and outdoor activities. And what will happen is that list of students participating must be kept by the school in case for contact tracing.
And what are the protocols in place for cafeteria and lunches?
Yeah, another great question. So students may actually eat together outdoors or indoors with a minimum distance of 2 meters maintained between the class or cohorts, and then as much distancing as possible within the cohort. So now use of cafeterias is permitted this year as long as capacity limits are in place to enable that 2 meter distancing between cohorts, and again, as much distancing as possible within the cohort. So again, we're encouraging staggered times to eat lunch is still the recommendation to limit the amount of people and to allow for distancing. Now students are encouraged again to bring their own water bottle, to label it with their name and to not share it with others. So, and also a big change this year is outside food delivery programs such as Pizza Day are permitted, provided that food handlers use adequate safety practices. So I'm sure many students and parents are going to be very excited about this change.
So have the isolation recommendations for contacts of a positive case changed from last year?
So this has changed since last year. So if a student or staff or visitors are exposed to a positive COVID case at school, we at Public Health will work with the school to determine who needs to isolate. So based on many factors, including now their vaccine status. So both vaccinated and non-vaccinated students may be initially asked to isolate and wait upon further direction from Public Health as to whether they can return to school. So what is different this year is those students and staff who are fully vaccinated against COVID-19, so meaning it has been 2 or more weeks since completing their second dose series when the exposure occurred, will not be required to isolate, even if exposed to a case, as long as they have no symptoms. So this also applies as well to individuals who recently were infected with COVID-19 in the last 90 days and have since recovered. However, all students and staff who are not fully vaccinated at the time of exposure will still have to continue to isolate. The recommended time, though, of isolation has shortened to now 10 days from the last date of exposure. Also, Public Health will provide testing recommendations for both vaccinated and unvaccinated staff and students through communication with the schools. So anyone who even has one symptom of COVID-19 should isolate and get tested as soon as possible. Testing is, of course, very important if you have exposure, as an infected person may not show any signs or symptoms of COVID-19 and can still spread the infections to others. So for students and staff who are isolating from exposure to a case and decline testing as well, their isolation will be extended as well an additional 10 days. So they could be isolating for a total of 20 days if they do decline testing.
So what are the recommendations for household members of students who are exposed to a case of COVID-19?
Yeah, so if your child was exposed to a case and is fully vaccinated and symptom-free, then no one in the household needs to isolate or stay home. Now, if your child was exposed to a case and is not fully vaccinated with no symptoms, then household members who are also not fully vaccinated should only leave home for essential reasons such as siblings going to school or going to work or to get groceries or medicine. Household members, though, who are fully vaccinated do not need to stay home. Now, if your child develops symptoms after exposure to a case of COVID-19, then all household members who are not fully vaccinated need to also isolate at home until the child is seen by a healthcare provider or tested negative for COVID-19. Again, vaccinated household members are not required to isolate at home. Now, if a child with symptoms was advised to be tested and testing is declined, then unvaccinated household members will have to extend their isolation an additional 10 days after their last exposure to their child while their child was infectious.
Okay. So where can I get my child vaccinated against COVID-19?
Yeah, so getting you and your household vaccinated against COVID-19, if you haven't done so already, is the best way to protect your family from the COVID-19 virus and, of course, severe illness, hospitalization, and even death. So there are many clinics available through Niagara, and you can check our website to find a clinic nearest to you. Niagara Region Public Health is also working with schools to provide clinics for your school community for all individuals born in 2009 or earlier. And vaccine appointments can be booked through the provincial website as well, or by calling the provincial number.
And what are schools doing to help improve indoor air quality this year?
Yeah, so school boards are expected to continue optimizing their air quality in classrooms through improving the ventilation and the filtration. So Niagara Region's environmental health, public health inspectors have been making visits to schools to inspect their ventilation systems and make recommendations as appropriate. So school boards are also encouraged to support outdoor education where possible and open windows where this improves the natural ventilation in the classrooms.
All right. Well, thank you, Ashley and Pam, for sharing what back to school will look like for this year and providing suggestions for parents to help prepare their kids for back to school. Where can parents get more information about back to school recommendations from public health?
Yeah, so I know it's a lot of information to digest and, sometimes you just need to go back and look at it. So our website does have a lot of information for back to school and COVID-19 information, vaccination information. So you can go to our website at www.niagararegion.ca/health. We will also include that link for you. Now, if you ever do have questions, we do have a COVID-19 information line as well. And that phone number is also available on our website. So you can speak with a public health professional by phone to get some more information and to get your questions answered as well.
Wonderful. Thank you once again for joining us. The resources, of course, that were mentioned will be provided below. And we wish you and your family all the best for the new school year.